We are going to be transitioning to our next speakers. Just before we start, I mentioned earlier, not all of our speakers were able to be here live. And so this next one, we just wanted to highlight and thank those who have been a part of serving us during a pandemic. And so there have been essential workers that have served us packing our food and picking our food. I've watched photos even over the last week out in California in the wildfires of immigrants who have been in the fields picking fruit and picking vegetables while there is red skies and fires all around. And I just can't comprehend that job. All the way up to the home healthcare workers and those who have served us tirelessly in the medical fields, and so many others. Right now, I'm thinking of teachers as they're figuring out how to educate our children in this pandemic in its unprecedented ways. This next segment is a conversation that I had with a nurse practitioner that is here in Ohio, and he's going to share a little bit of his story of serving during the pandemic. And then we are going to transition over to a couple of our business leaders who are going to be interviewed on some of our economics questions for Ohio.
So my name is Deshaun Kamasa, and I'm a family nurse practitioner here in Canton, Ohio. Starting out, becoming a nurse or working in the healthcare industry was all about helping people. I started I guess in high school thinking of doing something in a helping field, and I wanted to be a police officer. And my mom was like, no, you're too short, you're too small, and you'd be better suited in a healthcare field. So I looked into nursing, something she had always wanted to pursue, and it turned out to be a pretty good fit. I've enjoyed it. Becoming a nurse practitioner, I wanted to translate that into the mission field because I felt that nurse practitioners, you could have some level of medical knowledge to be able to treat and manage care, and maybe that translates better into a mission setting that doesn't have as much resources. So it turns out that mission setting is right here in Canton, Ohio right now for me. So get to use everything that God has given me right in the city where I live. Right now I'm in a clinical setting, outpatient ambulatory, just a family practice office. And I worked in the hospital for 9 years as a registered nurse, and just about a year now as a nurse practitioner in the family practice setting. It's been difficult in different ways. I'm not being in the hospital setting. I feel like the level of anxiety would be maybe a little bit more dealing with patients that are acutely ill, but it's still, anytime you're having people ask you questions about, should I have this checked out? What does this symptom mean? I've been exposed in this way or that way. It's been definitely nerve-wracking and a moving at breakneck speed, trying to keep on top of the new recommendations and trying to educate people as much as we can. So definitely a completely different time to be in healthcare than the previous 9 years that I've been working in it. Yeah, so I was born in Kenya, and my family and we lived there for the first 7 years of my life. My dad worked in a organization called National Council of Churches in Kenya, and so he coordinated a lot of working with churches and planting and making sure that they got up and running. He traveled a lot. And one of the things he did was he made connections here in the United States, and they eventually one of the regional conferences, the Friends Church recruited him to come here almost as a liaison for missionaries and churches here. And so in 1996, we packed up the family and flew in a jet, which there's plenty of questions that I've gotten. How did you get here, over the years? But we came here and established in Richmond. But yeah, so our immigrant story was my dad came on a work visa through the Friends Church, and was able to work in Richmond, Indiana. And then from there, we went to different places. Kind of grown up here. Now this is where I call home. Working in healthcare, I would say the most diversity I've seen actually in Canton has been in the hospital. because many of the residents, many of the physicians that are seasoned have come from, places that are in the Middle East, from Southeast Asia, from South America. I've dealt with several physicians just through the cancer center that, two physicians that I dealt with frequently were originally from India. They came as adults and came as physicians and do their training after as adults. And the contributions I've seen from them is that they, just like anybody else who's trying to, I guess, achieve effectiveness in their career and their work, they're incredibly hardworking, incredibly diligent in what they do, and want the best outcomes for what they do. And so in my experience, working with these individuals and working alongside with them and realizing that the main goal is ultimately better patient outcomes, I have really seen just excellence in many of my encounters. So definitely worthwhile contributions. Yeah, so from a policy standpoint, I think it would be great to not make the road harder for professionals who are wanting to work in the system here from healthcare to contribute to the healthcare industry, but make it easier for them, to make it more appealing for foreign-born immigrant professionals to come in and work alongside and train, doing residency. And I know that several of the residents that came through were initially working on kind of just that student visa, and then having to transfer over to a professional visa, and those kinds of allowances, I guess, would infuse the American healthcare system with excellence from around the world. And I think that's really important, not just for those professionals, but for American-born healthcare workers to expand their viewpoint of what healthcare advance looks like. I mean, right now we're going through a time in the American healthcare system where we're trying to figure out so much. It's a really complex and frustrating and an imperfect system, and there's no such thing as a perfect system. But I think the first step is recognizing that we have room to grow, and there are individuals from around the world who could help us in realizing maybe some of the blind spots culturally that are keeping us from providing the best healthcare to the most people.
Thank you so much for watching Deshaun's story. He just has loads of great information. We will, just as a reminder, put these videos on YouTube in the future. So I will send an email out to everyone who's registered. And thank you for so many of you being here with us today. It's just been really encouraging. I would like to welcome Kyle Natorp and Adrian Bota to join me. This second to last session, I can't believe we've gotten through this, is we're going to have an economics in Ohio. And as I said in some of the emails that have gone out to everyone who's watching, we are not going to solve everything. So we are not going to give a little bow on how to fix all of our economic problems and needs, but we really want to have these complex conversations. And so with both of these gentlemen, just really appreciate you giving your time. I'll start with the first question. Kyle and Adrian. Kyle, maybe you can go first. Could you both introduce yourselves? Where do you live and what do you do?
Sure. I'm Kyle Natorp. I'm in Mason, Ohio, and I'm the CEO and fourth generation owner of a nursery, landscape, and garden center retail business located here. So we employ about 170 people seasonally and about 90 year round.
Thank you. And go ahead, Adrian. Why don't you introduce yourself? Oop, we got you on mute.
Yeah.
So you got it. There you go. Go ahead.
So my name's Adrian Bota. I live in Cleveland, Ohio, and I am the founder and CEO of Origin Nutrition. It is a nutrition company that currently has multiple verticals in food and developing a few different nutritional options for pediatrics, and adult nutrition. And I was born and raised in Romania. I am an immigrant that came here at the age of 10 and came from Romania along with our family in the early 90s.
Great. And we might get some time for some of your story in a moment, Adrian, but we'll stick to economics for the first part of it. So when we think of the subject of immigration in Ohio, what are some of the questions and things that arise in your industries?
Well, for us, I mean, agriculture is a very seasonal business. So immigration can play a big role in the sense that we use government visa programs to bring in employees during our busy season when we may need employees for just 2 or 3 months in the year. So those programs are really important for us to get the work we need completed because we have such a short time window. And sometimes finding that short-term employee, particularly where we're located in Mason with pretty high employment, even today, that becomes challenging. And we need those seasonal people to keep our full-time people employed as well.
On our end, we're a little bit different in that one of our focuses is in the dairy nutrition world. And one thing that you'll know about dairy cows, which we don't own, but we have a network of partner farms around the state. What happens is, there's no seasonality to dairy farming. And so that is a year-round kind of thing. And certainly there's a large component of the immigrant labor force that is very helpful for dairy farmers year-round, and it's needed. It's absolutely needed. In that world, dairy farmers have been beaten up for the last number of years, with milk consumption being down over the last 40 years, but more particularly in the last 2 or 3 years, pricing has really squeezed a lot of dairy farmers, unfortunately, and it's perhaps the most difficult time in their lives. But that's one component of our business. The other component is research and development and the nutrition side of what we do with this these unique products, this unique powdered dairy milk that we have produced. And so it really taps into folks from other countries. The specific things that make our products unique have caught on in India and China, for instance, and there are experts there. There are experts in New Zealand who are writing books and research papers that are being conducted. And so tapping into everyone from the migrant workforce or immigrant workforce on the dairy side, all the way up to PhD researchers and R&D folks that can help us to continue to develop unique nutritional solutions. And again, it travels with the fact that some of the unique things that we are doing are not so unique in countries like New Zealand, China, and India, where there are more heritage breeds of cows, and some of this has already been developed. And so we're taking their unique knowledge and experience and applying it here in the US.
Just to clarify, because I don't think people all understand cows, could you just explain why yours is unique? Because then I think that'll help this conversation move along.
Sure. So we work with a specific heritage breed of cows, of which there are only about 14,000 left in the US. And these heritage breeds of cows used to be something that we did in America very well. It was something that we were the leading experts in the world. But when the government decided, and industry decided back in the era of the Great Depression, World War II, that the quantity of milk was going to be more important than the quality of milk, we went to basically all Holstein breeds. So when you see a black and white dairy cow, that represents about 98% of all the dairy in America. And that's a modified and frankly lower quality version of dairy. And many countries around the world have sustained their heritage breeds of cows. And those heritage breeds of cows produce milk that is superior nutritionally, it's superior genetically, meaning that it allows people who are lactose intolerant or have a dairy allergy to be able to drink it. And also it's better for the environment. And so there are these unique characteristics around heritage breeds of cows. Other countries will separate that milk and will bring that milk to market, whether it's in its fluid form or in a powdered form, but we don't currently do that in the US. And so Origin Nutrition is sort of at the forefront of doing this, working with heritage breeds of cows and bringing something back, something that America used to do very, very well, bringing it back. But we don't have the expertise anymore here in this country. And so, as I mentioned, others in other countries are further along in utilizing the unique nutritional components from these heritage breeds of cows in a unique way, and bringing innovative products to market that, again, are better for human beings and better for the environment, even better for biodiversity of cow breeds by helping to resurrect these breeds.
That's really helpful. I'm going to kind of answer questions from the chat as well as the questions I have in advance, just because I know we haven't been able to get to as many of them with our shorter sessions. One of the questions we have, and either of you could answer this, is why is it necessary to bring in seasonal workers via the visa process when so many Ohioans themselves are said to be out of work?
In our case, we are constantly advertising and trying to hire local employees to fill those jobs. The challenge, I think, for us is it is a seasonal job. It is a 3-month job, so there's a limited, I think, number of people that are looking for that. They're looking for more of a full year-round position. And while we have those, not all of our jobs fit that qualification. Challenge for us too is our busy seasons April, May, and June. We do 70% of our business then. So even the college kids that would be a perfect fit for us, unfortunately, they're not really available till end of May when they're out of school for the year. And at that point, we're actually starting to slow down. So it's a challenge there. And what we found is the visa employees have been able to fill that void for us. For every one seasonal person, that keeps us with about 3 full-time people employed. But like I said, we only have so many of those jobs year round.
Thank you so much for answering that, Kyle, and thank you for that question. And that is some of what we need to wrestle with as Ohioans. My dad worked for 40 years for Ford, and so I know there's these crunches we feel when things like the auto industries are moved overseas, and we need to have these conversations about what keeps some of these jobs here. But then we also have industries like yours, Kyle, that due to the nature of them and the timing of them, do require more seasonal employees. Another note I just want to throw out there for folks who don't know immigration law, but actually almost every single one of our visas that involve work, in fact, all of them that I can think of, the proof in being able to ask for these visas has to be that an American cannot fill this role. So it is always within these like shortages. Go ahead, Kyle, if you want to jump in. I was
going to even add to that. Actually, when we apply for those visa programs, we are required to advertise that position. So any U.S. citizen could actually take that job. So if we look for 10 visa employees, we advertise for that. And if we get 2 U.S. citizens apply for that job, we have to hire those 2, and then we only get 8 visa employees. So the reality is we never get anybody applying for those jobs when we do post them.
Yeah, and for those who've sat through the whole 3 hours, I know some people are ducking in and out in between work, but Stacy, the immigration lawyer at the beginning, brought up that issue of the reason why companies such as yours and others have to apply years in advance is anticipating the shortages that'll come, but there is an ongoing advertisement. And so these are some of the tensions. We want to keep Americans employed, we want to keep Ohioans employed, and we want to keep companies such as Netorps open, and we need to do both.
And I'd add one more thing too, another misperception I think we hear a lot as well, we can get that labor a lot cheaper. And the reality is twofold. One, the government sets the rate that we pay, and we cannot pay any domestic US employee less than what we're paying the visa employees. And in actuality, there are a whole lot of other costs associated with the visa employees on top of the pay that they receive. Through the fees the government charges and housing and all the other things that go involved. So it actually ends up being more expensive. So if we could hire local, it would be cheaper for us to do so.
That's great. I'm going to ask another economics question, but Adrian, in the chat, somebody is asking for a website for your nutrition company, and I do not know that off the top of my head. If you could give that in the chat or...
Sure, no problem. I did it.
And then, so let's talk about that. So a lot of Americans have lost jobs during this pandemic. There are often questions about immigrants and Americans who are competing for the same jobs. We just kind of brought that up, a little bit of that tension right now. Would any of you be able to address this concern in another angle? What do we do when people are out of work in our state or around the country? How do we make sure that Ohioans are working, as we are also talking about immigration policies?
That's a tough one. In our case, we are trying to hire all the time, pretty much year round. Maybe not in January, February when the weather's not conducive, but the rest of the year we're constantly looking for employees. I don't know how the government could provide that information to us. I don't know. We are in Mason. It is a pretty high employment area and a lot of high paying jobs around here. But for us, we just don't get the people coming in the door, or the occasional one that comes in the door. We ran the numbers 3 years ago. And for every 3 people we hired locally, we ended up keeping 1, meaning that the other 2 didn't last more than a week or 2 before they quit, moved on to another job, or just decided that this work wasn't for them.
And how did that compare? Sorry to jump in, Cal. How did that compare with immigrant workers?
Well, I mean, the visa program, they're coming here to work, and that's what they're doing, and I don't know how they do it myself, because they're leaving their families for 3-6 months at a time, and traveling here, and they're here for one thing, and that's to work and make money to basically support their families back home. And then they go home to see their families the rest of the year, and they come back year in, year out.
So that retention rate is extremely high, I imagine.
I think, over the 20 years or so we've been using the visa programs, we've only had, I can only remember 2 that didn't work out. Now, some people don't come back another year. A lot of them change over year after year, but as far as coming here and then not lasting for that seasonal contract, we've only had 2.
And so, having been put in that position myself, that offsets some of those higher costs, right? Because hiring and rehiring and training and retraining, et cetera, is extremely time consuming and costly, right? And so that having that dependability we found is just so key for us, knowing that someone has started and they're locked in and they want to be there, they will be there for that time. Having that predictability and being able to rely on that for us has been really, really important.
Absolutely. And I think you said the same thing. If you could find a domestic worker, well, in our case, it's seasonal. As I say, find a domestic worker that wants to work 3 months every year and then take the rest of the year off, we'd have them back every single spring to help us out.
Absolutely.
I would just like to highlight, if you guys look up a website, it's called allofuscare.com. At the beginning of COVID, the National Immigration Forum came together with a collective of about 50 organizations. And if you go to the part of the website that lists all the organizations, you're going to laugh, because if you know anything about them, they do not look like they all belong on the same sheet. But it's an association of everything from the Southern Baptist Convention to the George Bush Institute to the ACLU, coming together and saying, what it's going to take for us to get through this pandemic is all of us together. And so one of the things that has been really striking to me is, we need these knock-on effects. So that campaign was mostly about healthcare, about our essential workers, about it not pitting Americans versus immigrants. Like, we really need to pull together to survive this pandemic and to serve each other in the places that have job losses and those who are on the front lines. But really, that is also about growth as a country. And so I think it's important that we kind of think of these and dig into, it's really easy to give a tagline on the left or a tagline on the right for a campaign. It's really hard to say, how do we continue to have Ohioans all working and make sure there's enough workers that also support our businesses to grow, to be able to hire more people. And so, I just encourage you, as you're listening to this, to make this conversation more complex. We need to think about, the Cleveland Clinic doctors that are not able to arrive here right now because of travel bans, as well as the agricultural workers that, serve Kyle's industry. We have some lawmakers or their staff on this call. Adrian and Kyle, would you be able to speak to any kinds of particular policies around immigration that could help grow Ohio's economy, whether it's your own industry or another pet industry you've paid attention to that you know would help us grow our economy as a state?
That's a tough question because I think a lot of the immigration policy has got to come down federally. But as far as Ohio goes, I guess making sure that we don't do anything that makes immigration any more difficult in Ohio than it already is, countrywide. My guess is it's probably pretty limited as to how they can make it better, but if we can keep from making it more difficult or more challenging, that would be the main thing.
I would say that whether it's on the Ohio level or federal level, that indeed making it easier for founders, CEOs, managers, et cetera, to not jump through those hoops, to be able to, in a timely fashion, fill the roles that we have is absolutely key. If we're able to hire the right people for the right jobs, then that creates economic activity all around. If that individual is from Ohio, born and raised, that's fantastic. And that absolutely helps with economic development and moving the ball forward. If that individual is from another country and that person comes here, that also helps the economy. It helps us invariably. And if we are profitable as businesses, then we pass that along, whether it's to our employees, our shareholders, or others in our ecosystem in that community. And so I think it's recognizing that, making it seamless, making it as seamless possible, in perhaps putting things like technology to work. There might be an app for that. That shouldn't be out of the realm of possibilities, where we're able to do things that are less hands-on, less time consuming and intensive. And again, it helps us to move along our businesses, but also the community. And I speak as a guy who is in Cleveland now, right? And we have just been declared, as of last week, the poorest large city in America. And so that is not a great thing for us. And if you listen to today's NPR, for instance, or other interviews that have been done on this, they talk about the fact that the issue there is pay, and essentially it's the household income. And so if we are able to continue to hire people, again, from here, from other places, and our businesses thrive, we are then able to pay our employees more. And that's something we all want to do. If I am able to pay an employee $1 or $10 more an hour, that's fantastic. We love to do that, because we want employees to be happy, and we want employees to be feel like they're part of the team and motivated to help grow that on a daily basis. And so anything from the federal level or state level that helps to make it a more streamlined process, and that understands the needs and how we can further the economic impact, positive economic impact in our communities, in the state, nationwide, is helpful.
That's really great. That's really helpful. Just a last little note as we are getting ready to close up this session and go to our last session. I really appreciate Adrienne and Kyle for being here. For those who have more questions, you can email me and I'll put you in touch with speakers if you'd like to flush out some more questions. These are complex conversations. And so, there will be things on the education level in our schools and in our universities, making sure Americans are prepared for the jobs of the future. But then we also need a working visa immigration system so that our companies and our hospitals can have the employees that they need to have access to, and then through that grow jobs for all of us, whether we're immigrant born or American born. We really would love to see America to stay at the top of innovation and creation of the kind of country that we all envision as the best kind of America. Gentlemen, do you have any final thoughts with us before we close?
I would just say that as an immigrant, I think us all having compassion and understanding and thinking of others before we think of ourselves, as an immigrant and as a Christian, that is the ultimate in terms of ideals. Yeah.
And I just say thank you, Christy, for putting all this together. I think it's a great program you've got going here, and it's good to spread this information and educate all of us.
Well, thank you so much for being here. It's been such a joy to put this on. As we transition from Kyle, Natorp, and Adrian Bota, thank you, gentlemen, for being here. We are on to our last session. A few little notes for us. For those of you who have never done so, part of the reason we invite all of our senators for Ohio and our representatives to consider being a part of this call is we want you to communicate with them. And so if you've heard something today that you've thought, wow, that's made me want to raise my voice about this, or thank them for this, or ask that we could fix this policy and make it better, feel free to get in touch. I'll have a follow-up survey where we can put you directly in touch with the offices that represent you. But I'd love you to raise your voice. So I always think of the advocacy on the political level as stewardship. So as a Christian, I use these nerdy Christian words like stewardship, but we live in a country that enables us to have a voice and to talk about how we want to shape the future together. And so that will be in your follow-up email as this quick survey. Give us your details. We'll put you in touch with those offices. And I'd encourage you to just ping them a quick note on something that you've heard today.